Bueno, empezamos ya. Nos encontramos en Berlín con el Congreso de la Academia Europea de Neurología con el doctor Eugen Trinka, uno de los más importantes especialistas de neurología y epilepsia en el mundo. Todavía se desconocen las causas de la epilepsia.
No, we still welcome Professor Eugen Trinka. We can ask you why it's still unknown, the epilepsy? You think it's still unknown in the world?
Yeah, so that's a very good question. I would not say unknown, I would say it's not completely understood, because what we know about epilepsy that it's a variety of disorders which have different causes. About 2/3 of the causes of the epilepsy are acquired or can be attributed to a certain disease. It may be a metabolic disorder, it may be a genetic defect, it may be a developmental disorder of the brain where the neurons don't go into the right place and that they make electric discharges leading to seizures. Another part we know is that we can have after stroke, after traumatic brain injury, after encephalitis, we can have seizures in a patient. But what we don't know is that in some patients, seizures come and you don't find anything. And this is the group which is about 1/3 at least, where you don't know what is the origin of the seizures. Research is going on, of course, and it's concentrated to those groups where you don't understand the mechanism of the disease. It's also not quite well understood why, for example, from 100 patients with a severe traumatic brain injury, only 20 or 30 get seizures and the other ones do not get. So there are obviously protective mechanisms in the brain in every patient which are effective in one part of the population but not effective in the other. So our aim is to study that and to fully understand it in order to provide drugs for those patients who have seizures at the moment.
Uno de los problemas que tiene la epilepsia es el estigma que crea social.
And one of the problems that we believe that epilepsy has is a stigma in the society, right?
Yes. So there are several studies looking at stigmatization of people with epilepsy in different countries of Europe, Asia, North America, and all show the same, that the less you know about epilepsy, the higher are the prejudices and the stigmatization. The closer you are related to a person with epilepsy, the more you understand that and the more you accept that. So, which has a good and a bad connotation. The bad connotation is that it's simply devastating that people with epilepsy are expelled from their jobs, expelled from friendship, expelled from their peer groups simply because they have seizures. Sometimes even they have naughty words for them to designate this patient as a patient with epilepsy. And on the other hand, if we acknowledge that there's an inverse relationship between knowledge of epilepsy and stigmatization. The lower the knowledge, the higher the stigmatization. We might go that way, that we improve the knowledge and lower the stigmatization with campaigns, with educational campaigns of the teachers, of the caregivers, of the publics, in order to accept that with the goal that epilepsy comes out of the shadows. It's one of the most common neurological disorders, but there are so very few people standing up and saying, well, I have epilepsy, let's do something about it.
Los nuevos datos de FICOMPA, ¿qué mejoras ofrecen con respecto a otros medicamentos contra la epilepsia?
On the new data information of FICOMPA, how will you relieve with the new product, the new?
Well, there's a new drug on the market. It's perampanel, and the brand name is FICOMPA, which has a unique mechanism of action. At the moment, it's the only drug influencing the excitatory mechanism of epilepsy. If you have a concept of seizure generation, that there is an imbalance between excitatory and inhibitory mechanism, Previous drugs also only influence the inhibitory mechanism. This is the first one, turning down the excitation which you find in patients with epilepsy, irrespective of the cause. So this makes hope that a new mechanism turns the field to that. And the experience which we have now, which are far more than 200 patients, is very good with the drug. It's, you can give it once daily as a bedtime or as a sleeping pill. You can have a high efficacy in these patients who were previously not seizure-free, and it's well tolerated when you use it as a once daily nighttime medication. So that's one of the new aspects. And the other new aspect of this drug is that it has a very broad spectrum of efficacy. It works also in those patients where the brain is structurally normal, but rapid networks are engaged at the seizure onset, leading to primary generalized tonic-clonic seizures without any focal sign. And the recent study showed that this drug is highly efficacious in the patient group with primary generalized tonic-clonic loop, and that's clinically relevant, of course.
¿Es cierto que la epilepsia está afectando cada vez a gente más joven?
If it is true that epilepsy is hitting more to the young people, the younger.
Well, there's a U-shaped incidence curve. You have a high incidence in the very young, which drops down in the adulthood, and then you have the highest peak of newly diagnosed seizures in the elderly. So previously it was primarily acquired in the younger ages, but as the population is aging and we have a larger increase of the elderly population, we understood that the highest number today of newly diagnosed epilepsy is in the late adulthood and elderly population. So the population changes, and at the moment we have more elderly than children with that, and we improve pediatric care so that fewer patients with epilepsy are acquired nowadays than, let's say, 3 or 4 decades ago.
Usted es uno de los neurólogos más importantes a nivel mundial. ¿Esta especialidad está avanzando tanto en los últimos años?
You're one of the most important neurologists in the world. Do you consider that this is advantage so much? It's going further and further for more?
Yeah.
It's going to more?
So my humble judgment is that there are, of course, a lot more things that we do not know. But what we know is that this is a major improvement in epilepsy treatment. We have more drugs than ever which are efficacious. Some of the developments have not been fruitful, but many of the developments give us a huge armamentarium to treat patients with epilepsy. The 2 recent developments, one is eslicarbazepine acetate and the other one is perampanel or Sebinix and Fycompa, both have specific advantages for the patients we have. In one is an extremely well tolerated with a good efficacy, and the other one has a broad spectrum of efficacy and works in very desperate cases also. So this is a true advantage which we have, and we have also moved ahead very much the field in epilepsy due to the research which has been going on. The WHO accepted epilepsy as one of the major diseases where research should be fostered and increased in order to better understand it and to better treat these patients.
Many thanks, Mr. Eugen Trinka.
Thank you very much.
Thank you very much.